Okay, so where are we at today? So today we see that a government watchdog known as the Project on Government Oversight has found that over 31 people have come forward with whistleblower complaints in relation to the virus, okay? With 15 of those people reporting retaliations for being a whistleblower. So they were already risking their job to come out as a whistleblower. Then they were retaliated against for whistleblowing, right? Exactly what they were afraid of would happen is what's happening. So we're going to focus specifically on Dr. Rick Bright. He is the individual who's getting most of the press right now, although there apparently is a number of whistleblowers and a number of which have been retaliated against. The one right now that's most in the news is this Dr. Rick Bright, formerly with the Health and Human Services, and he was retaliated against. He's saying that he lost his job, was removed from his position. Basically, they transferred him to a less desirable position because he wasn't playing ball. And we'll hear exactly what he has to say about the situation, about why he wasn't playing ball. So let's go ahead and listen to what Rick Bright has to say about this.
It was my job to ensure that our country had life-saving tools to be as prepared as possible for a pandemic like COVID-19. And to date, my team at BARDA has formed over 40 industry partnerships to accelerate the availability of tests and treatments and vaccines to address this pandemic. The past few years, however, have been beyond challenging. Time after time, I was pressured to ignore or dismiss expert and scientific recommendations, and instead to award lucrative contracts based on political connections. In other words, I was pressured to let politics and cronyism drive decisions over the opinions of the best scientists we have in government.
Okay, so this really comes to no surprise, really, to anyone who's been paying attention. There's been a long time that one of the common complaints about the government is that there's lucrative contracts being given out to people who shouldn't be receiving them. There's this cronyism going on, all this stuff. So of course, the government's been guilty of that for a long time. The danger is that it seems to be getting worse. And the real danger is right now, the problem that we're inside of is costing people lives. We're literally losing tens of thousands of lives. This is the kind of thing where you don't want to lose any human life that doesn't have to be lost. We're talking about thousands of human lives. And it really kind of seems like what's going on in our government right now is there's a decision being made about, well, do we want to keep the rich really, really rich? In fact, do we want to make sure that the rich are getting even richer? Or do we want to make sure that working people are surviving? And that's a problem because it's literally costing us lives. And not down the road, right? There are lots of things that cost people lives, but you don't see it happening immediately. We're talking about lives that could be lost in the next 2 weeks. You get the virus today, you might not be around 2 weeks from now. So these are problematic, right? This is not a little thing. This is a big thing. So Dr. Rick Bright came out, said, look, here's what I've been fighting. Here's what I've been trying to deal with. And, it's a problem. So let's take a look at an article that goes a little bit deeper into things here. Okay, so basically we've got this. Official fired for standing up to Trump's coronavirus corruption files whistleblower complaint. Apparently he's not alone. Right now, just to be clear here with everyone, not all of the whistleblower complaints are on the level of Dr. Rick Bright's. His seems to be pretty severe. But when you're talking about 31 whistleblower complaints, you've got the spectrum from cases that are a little bit smaller all the way up to cases that are quite severe, like Rick Bright's, where he was removed for trying to stand up and make sure that the lives were actually being saved. But the people in government right now weren't so favorable to that. Okay, so right out of the gate, the U.S. government official overseeing the purchase and funding of vaccines, treatment, and tests for the coronavirus was fired in retaliation for his efforts to stand up to the Trump administration's cronyism, according to a whistleblower complaint his attorneys made public today. So that's kind of the situation. This wasn't just some person randomly working at some agency. This was a person that was making important decisions and had been trying to speak up and say, you know what? This isn't serving people. This is not taking care of our goal, which is to make sure that when a pandemic hits, we're prepared for it. And then when the pandemic did hit, as we'll see as we work our way through this article, some pretty sketchy stuff was going on. All right, Bright tried to call attention both to the lack of scientific evidence of the drug's benefits and its safety. Nevertheless, they say the administration promoted it as a panacea and demanded that New York and New Jersey be flooded with these drugs, which were imported from factories in Pakistan and India that had not been inspected by the FDA. So we have these drugs being put out there that aren't even close to being considered safe, right? There had not been proper research. Everyone kind of understands, we're moving really fast in the pandemic because you're trying to take care of people. We're trying to get the vaccine to the market as soon as possible. Certain things are going to have to be done to streamline the system. But what you still have to be doing things in a safe manner. You can't just come out with drugs that are unsafe and haven't even been looked into, and factories in Pakistan that the FDA doesn't know anything about, right? That this is not the way to be conducting things. All right, and the article ends with something that's quite important because it relates to what we just talked about. A Veterans Administration study showed that hydroxychloroquine failed to offer a clinical benefit and found that COVID-19 patients who took the drug were more likely to die than those who didn't. So, this is why you still, even in emergency, you have to be doing things in a way that is safe for people, because in this case, drugs were being given to people that actually increased their likelihood of dying. That's obviously the opposite of what you should be doing when people go in to get help. So Rick Bright was standing there. He was talking to his superiors and saying, look, I get that the administration is trying to push this hydroxychloroquine, but it's not been shown to be safe. It's not been shown to be effective. And in fact, he turned out to be right. Okay, so this is a situation where the scientists are not being listened to. Right? We're ignoring the science and we're just going with the guy that's in charge. And that's dangerous. Even if you like Trump, he's probably not someone you should be taking medical advice from, right? We need to be putting drugs and treatments out there that at least are going to benefit people or at least do no harm, right? That's one of the things that medical professionals are supposed to be looking out for. Do no harm. You don't want people to be worse off because they come and get your help. And now that's what the government is doing, right? And I get it's a desperate situation to try to help people, to try to get the economy moving, but you still have to be listening to the scientists. You still have to be listening to people who are saying, well, we see evidence that this drug should be given to people, or no, there's evidence this drug should not be given to people. So it's just all kind of a big mess here. So I don't expect this to end anytime soon. When we're talking about 31 whistleblowers, there's a couple things you got to think about. One, it's probably not the last of the whistleblowers. We're probably going to see that number of whistleblowers growing over time. So there's more and more things they have to talk about. And it shouldn't be surprising at all to think that Congress is probably going to want to talk to a number of these whistleblowers. Now, that runs into the video I talked about the other day where Trump is always trying to block people from testifying to Congress. Even once they've left the administration, Trump is trying to block them from talking to Congress. So we'll see. Next week, there's 3 cases in front of the court where Trump is trying to block different organizations from trying to get information about him to see if wrongdoing has been done. So this is another case where I can't imagine he's going to want former employees of the federal government going and testifying about him. So Congress will in all likelihood end up subpoenaing some of these whistleblowers. And then the question is, will they show up? Does Congress are they actually going to get around to having the muscle to actually protect their own power and the American people? Or are they just going to keep saying, yeah, we'd like these people to come testify, and then Trump says, no, I don't want that to happen, and then that's the end of the story? So these cases in front of the Supreme Court are going to help or hurt, right? But they'll help decide the situation. And then we'll see. I guess it's going to be a case-by-case basis with the different whistleblowers that Congress decides they want to see. Are they actually going to end up testifying at some point? Now, there hasn't been talk yet about these whistleblowers testifying before Congress because it's all just sort of developing at the moment, right? This is sort of early on in this story. But I can't imagine that Congress is not going to want to talk to Dr. Rick Bright. I mean, his testimony that he's given publicly seems pretty damning. So it would be really good to get him under oath in front of Congress and saying these things so we can get a clear look at exactly how the Trump administration has handled this and how they're handling dissent, right? It's one thing to handle dissent when you're just trying to basically steal money from the government and give it to your rich friends, which apparently is what's happened. There was a case where it was talked about. Hold on, where was this? Right, I mean, it's all pretty sketchy, right? Let's take a look back in the article. There's a quote here, and Azar wanted him fired because Bright resisted what he saw as the outsized influence of industry consultants, including one who represented a company with ties to Trump's son-in-law, Jared Kushner. So it's just the same thing we've been seeing through this whole administration, which is anytime any event happens, they look and say, how can we make money off this? How can my friends make money off of this? How can we enrich ourselves? That's bad enough. But then they're going ahead and sending out drugs to people, which end up killing them at a higher rate. So we've got the level where things aren't going well, and then we've got this level where they're even worse. It's bad enough stealing money from people. It's a whole nother story to be killing them because you know it's going to end up making you money in the long run. So all of these are reasons why I really hope that we see Rick Bright testifying in front of some of these subcommittees in the House so that we can get this stuff under oath. It's one thing for him to say it on these news agencies and for us to hear what he's saying. That's important, obviously, but we need it under oath, right? Where it's given a whole nother set of weight. And of course, he's going to be attacked while he does that. But apparently he's willing to do that because he's already putting himself in that spotlight. I'd love to see him in front of Congress. And getting all this stuff on the record, like the official under oath record. So this is a story that's going to develop as things go forward. We'll see what happens and we'll update here on the channel. So thanks for checking out the video. Remember to hit that subscribe button so you can check out all the new content as it becomes available, and we will see you in the future.